Okay. Thank you all for coming to this briefing on toxic air neglected communities. This is a briefing on a series that the Center for Public Integrity and NPR have been doing called Poison Places. I think some of you will have heard the first two installments of this set of investigative reports. One happened Monday before last, and the last one happened yesterday. Over the next year, I'm Catherine McFate, the president of OMB Watch. This is a briefing that's been sponsored by us, the Bauman Foundation, and the Public Welfare Foundation, and I will introduce my colleagues from those two institutions in just a minute. Over the next year, we're going to be having a national conversation about the role of government, about the kind of society that we want to live in. We've got Tea Party activists on one side and the Occupy people on the other side. So I think this promises to be a lively and quite contentious but critically important debate for the country. One part of that conversation is about the standards and protections that we expect government to establish and enforce. What role should national government play in reducing the environmental and health and safety risks that citizens face? At root, that's what this series is about. What basic health and safety risks do citizens expect their government to protect them from? What happens when public interest and community health collide with private interests, some of whom may be very politically connected? What will it take to improve the enforcement of existing standards? How can we improve the overall effectiveness of our regulatory system? And what impact can journalists like these have as they expose firms that are not following the rules, point out the government regulators who aren't protecting the public, and arm citizens with the information that they need to hold both parties accountable? That's what we're here to discuss. That's the broader frame of this conversation. Here's how the morning's going to go. We're going to have two panels. This first one is the independent, nonpartisan journalists who have conducted this research and we have coffee coming, and gathered the information to make this work possible. Then we'll have a Q&A session, and we will also have questions from those of you who are on the webcast on the phone. If you want to email us questions, please do it at questions@ombwatch.org. And we'll have somebody come up to the microphone and relay those to the panel. Then they will move off. We'll have a second panel that's responding to their presentation, talking from two public health activists to talk about how this information can be used by citizens to push for better enforcement of current standards. Again, we'll have questions from the phone, questions@ombwatch.org, so you can pull those in. Then we'll stop. That will take an hour. That's the webcast. We'll stop the webcast. The panels will go out, and then we'll have another conversation with advocates about how this information can be used in the issues that we're dealing with. Before we begin, I'd like to invite Bob Shull from the Public Welfare Foundation, who's been one of the funders of this project, and Gary Bauman from Gary Bass from the Bauman Foundation to make a couple of comments.
Hi, thank you. I'm Bob Shull with the Public Welfare Foundation, and we understand that the lifeblood of any democracy is a vital, independent, a confident, assertive press that embarks upon enterprise, investigative journalism that tackles the tough questions and is willing to follow them wherever those answers may lead. Working families who encounter significant harms created by corporate interests have a particular interest in a vital, active press. And I can think of no better exemplars of the kind of press we need than the Center for Public Integrity and NPR. And we're really proud to be playing whatever part we can in helping this good work go forward.
And I'm Gary Bass with the Bauman Foundation, and want to welcome you to the briefing. It's really sort of the sweet spot for the Bauman Foundation when you have good use of interactive technology, you have investigative research, and you make use of the good old Freedom of Information Act to go get that data. So this is really a sweet spot. By the same token, it leads us with the point that Catherine McFade and Bob Shull were talking about is, what do you do when you have a problem of weak enforcement of air toxics? And for the Bauman Foundation, while the discussion today is about air toxics, the concern we have is about the safety of chemicals we're exposed to generally. And the ultimate solution is, how do we amass the right kind of data, the right kind of research, both from independent entities and from advocates, to talk about making us a safer, healthier society. So I'm very excited about today's discussion and look forward to it.
Great. What I will do is introduce all three panelists in the order in which they're going to speak, so we get the introduction out of the way and we can get straight to the heart of the matter. Jim Morris is on the left of the panel. He's the lead writer for this series and a senior reporter at CPI. He's been a journalist for over 30 years, specializing in environmental and public health issues. He was working at newspapers in Texas, California, as well as U.S. News and World Report and the Congressional Quarterly. He's won more than 50 awards for his work, most recently for a global investigation on the asbestos industry. Second speaker will be Robert Benincasa. He's producer of the Investigations Unit at the National Public Radio. He's been with NPR since 2008, analyzing data, developing visualizations, doing interactive applications. He too has worked on a number of prize-winning stories on issues as diverse as nursing home care and aircraft safety. Prior to coming to NPR, he worked at Gannett News Service, the Burlington Free Press, and worked on and now serves on the faculty of Georgetown program on journalism. And finally, we have Suzanne Reber, who is the investigations editor at NPR. She's facilitated reporting partnerships with ProPublica, Frontline, NewsHour, Center for Public Integrity, and the Center for Investigative Reporting. Her work has been recognized with numerous awards and prizes, too many to go over right now, but it's on your bios that you have sitting on your seats. She's currently on the faculty of Georgetown University. So with that, we'll start with Jim.
Thanks very much. Before I walk everyone through kind of a quick rundown of the project, I should say on a personal note that this represents, I think, sort of the culmination of about 34 years of reporting on the environment and public health, going back to late 70s in Texas. And this project in particular originated, I would say, a little over a year ago when I went to a place called Corpus Christi, Texas. It's a very dirty refinery town on the Gulf Coast. And I had been there 20 years earlier, went back last fall, October a year ago, to do some reporting, and was struck by how little things had changed down there. I had gone there in 1991 when I was with the Houston Chronicle, and had interviewed people who have to live next to oil refineries and chemical plants, and just the sense of helplessness and anxiety that these people felt. And when I went back two decades later, what was striking was how little things had changed. So I think that's how this thing got started. Officially, this project was launched, or the research for this project was launched early this year. And I'm going to just walk you through it real quickly. Poison Places is the name. It started on November 7th. That was a week ago Monday. With NPR, we've had, I don't know how many stories since then. We had one as recently as yesterday that we and NPR partnered on. We will have more in the next few weeks, some pretty significant ones, and we hope to continue it into next year. But let me just walk you through it real quickly, and then I will turn it over to my NPR colleagues. So the gist of this is that in 1990, Congress, Democrats and Republicans got together and amended the Clean Air Act, in part to deal specifically with these insidious air toxics, the really nasty stuff like benzene and arsenic, the worst of the worst, as it were. So they had the best of intentions. The Clean Air Act amendments were passed, and everybody thought things would get better. And to some extent they have. But, you know, there are still hundreds of communities around the country, and we've profiled a few of them, including a little town in Arizona just yesterday called Hayden that's been tormented by a copper smelter for literally 100 years. Hundreds of communities are still exposed to a lot of these chemicals. These things can cause cancer, birth defects, respiratory ailments, neurological problems, the list goes on. Back in the spring, when we were doing our research, I was reading an Inspector General's report, EPA Inspector General's report, and I saw a reference to a Clean Air Act watch list, which I'd never heard about before, that had been around since 2004. So my natural instinct was to file a FOIA request, Freedom of Information Act request, which I did on June 1st. And a gentleman in the EPA's enforcement office called me back a couple of weeks later and said, we got your FOIA request. We have never made this public before, but we're thinking about doing it now. And I said, well, that's good. And he said, just give us a couple of months, give us 45 days to verify the data, to try to verify it, and then if you'll do that, we'll release it. And I said, sure. So we got it. We got the July watch list. This is a list of alleged Clean Air Act violators, about 400 of them, that apparently have escaped enforcement for long periods of time. So they released it to us in late August. It was the July list. We subsequently got the September list just a few weeks ago before we published and before NPR aired its reports. And, you know, we were pretty happy to get that because these were facilities that, you know, the EPA's own enforcement staff was tracking, we're tracking. Okay. Let me go to our key findings. So again, toxic chemicals, toxic air pollution persist in hundreds of communities around the country. There are about 1,600 high priority violators of the Clean Air Act, according to our data analysis. So the watch list is a subset of that. About 1,600 high priority violators, about 400, give or take, facilities on the watch list. We learned, and this won't come as a surprise to some people in this room, that the whole regulatory system for air toxics and for air pollution in general is very much an honor system. The government relies on companies to report their emissions. The government relies on states to enforce the Clean Air Act, and as I think our stories have already shown, states don't do a very good job in some cases. And again, these are just some of the chemicals that are causing problems in communities. I think most of you are familiar with them, except maybe that one. Okay, I've already gone over that. And I'll just say that the series, which again is not over, has had tremendous impact. Series has already had tremendous impact. It's gotten national pickup. NPR's participation has helped us tremendously. It's gotten widespread coverage, not only by major media outlets, but by a lot of smaller publications. I don't know how many radio reports have been done outside of what you guys have done, but I think it's been quite a few. And I would argue we've already had an impact. Just this week, the EPA apparently has decided to make the watch list public. Watch lists, I should say, because there's a list for the Clean Air Act, the Clean Water Act, and the Resource Conservation and Recovery Act. So I think this has just happened in the last couple of days. I think we drove them to do that. And just last week, as we reported yesterday, the EPA is finally moving against this copper smelter that we wrote about in Hayden, Arizona, that's been contaminating the town with arsenic and lead for decades. And whether that's a coincidence or not, I don't know. But 3 days after we launched our series, the EPA did what they call issued what they call a major finding of violation against this smelter that could lead to millions of dollars in penalties and additional pollution controls. So again, I think we're already having an impact. I think that'll continue for weeks, and I hope many months. So thanks.
Great. Robert?
Yeah, have the PC.
You may.
Thanks. So, I do computer-assisted reporting. It's a term that some people don't like because it has a weird sound to it. But what we do people who do computer-assisted reporting or data analysis for news organizations, is we try to tell a story with data. And since we started doing that in a big way in the early 90s, we've faced a dilemma. First of all, when we get a database, it's always imperfect, it's always incomplete, and it's not the best way of telling a story. It's not the way we were trained as reporters to tell a story. It's just a big bunch of numbers in a spreadsheet or in a computer application. And one of the first problems that comes up is that when you have a database that's very granular, like this one, and when I say granular, every dot on that map is one emitter of air pollution, right? There's 17,000 of them. And we're storytellers. How do we tell 17,000 stories? And then, even if we told 4 or 5 stories in a report like we did, we talked about Arizona, we talked about Tonawanda, New York. What about the big picture? So there's this tension between telling a big picture story about air toxics, about relationships between regulators and emitters and state governments and the federal government, et cetera. And then we've got this problem of all of these communities all over the country. So as time went on from the 90s and as the personal computer evolved, as the internet grew up, we developed the ability to tell these very granular stories so that even though we're sitting here inside the Beltway, that individual, that reporter, that advocate, that business person, whomever, in somewhere else in the country can get information that's specific to their situation, that's a starting point for whatever action they might take. So, databases being incomplete, we use several databases to come up with this. Liz Lucas from the Center for Public Integrity, Dave Donald, they're the data people. They worked very hard on this. Our interactive guy at NPR, Nelson Shu, also worked to develop this tool to display the data. So there's a couple things in it. There's data about emissions, okay? They're from the Toxics Release Inventory, which some of you may be familiar with. There's data about enforcement. What has the EPA done with respect to a particular emitter? What is the emitter status from an enforcement standpoint? And there's data about risk. The EPA has a risk screening database that is pretty hard to work with, but we were able to develop it in such a way that we were able to add it into this database. So what we've done here is we've taken 3 sort of separate constituent databases, each of which on its own would tell a little part of the story, but brought together, and I'll show you in a minute, but brought together tell a more complete story and sort of empower the users on a local level to take that information and run with it. So there's a couple ways. One of the things that we liked about this tool is that there are a couple of ways of points of entry, as we say. You can just zoom right in by hitting the plus button, or you could do a search, and you can just come up with a city and say. And it zooms very quickly. It's faster than Google Maps. It's built on an application that splits the country into lots and lots of tiles, hundreds of thousands of tiles, and it puts the tiles together on a server and creates the visualization on a zoomed-in basis. And the user can click on a particular place, and they're getting information from all of those data sources about the emissions, about the violations, potential violations, The screening information, we went from 1 to 5 smokestacks. There's a detailed methodology about that online that I won't get into now. And then we provide a link to the EPA that's specific to that emitter. So our service idea for this, in part, was to give our member stations the ability to take a zoomed-in map, put it on their website for their area, and tell the story locally. And with our reporting partners, the same kind of thing, to allow a local journalists from an investigative news organization to also to tell that story. So that's pretty much it for the map.
Okay.
Okay.
Rebecca.
Thank you for your introduction. I worked with Keith Epstein from the Center for Public Integrity to edit and lead the project. And for us at NPR, we've had an investigative team since January of 2010. And we've got a couple of fairly large goals in doing that. One is we do want to tell investigative stories, traditional investigative stories that use our research skills and our abilities to sort of find out things that most citizens can't find out on their own. But at the same time, we're also looking for stories that connect with the audience, hopefully lead to change or empower them to learn more about what's around them, again, in a way that they might not otherwise be able to do, because that's why they're relying on investigative reporters to ferret out stuff for them. So this project was actually an ideal partnership for us because it met all of those goals. It's very deep investigative research that took many months before we showed up on the scene to work. Liz Lucas and David Donald, as Robert mentioned, working away at that data, making it somehow workable even before we arrived. But I do think that when we can bring two strong teams together like this, everybody's bringing brain power and resources to the table. And in our case, as Robert said so well, we are constantly trying to sort of democratize the data, tell a story that connects with people on the grander scheme, on the grander sort of patterns, but also lets them sort of feel what it's like. So in our storytelling, when we sit around figuring out what sort of stories we're going to do, this is kind of a perfect one for us because it's blending data and research also with the ability to tell some really potent narrative stories. So when we selected our first 4 stories, one was obviously about the watch list, which as soon as we knew that we were going to be able to get this, and we were still, I think, close to air, not sure how much of it we'd actually be able to use because they didn't really tell us how the criteria was set, and it was a great get, and it was a wonderful way to start the series, but it wasn't the only story. As Jim said, there were 1,600 high priority violators, and we had to pick of the stories that we want to tell, which ones are we going to pick. So we had a couple of criteria. We felt getting the audience to kind of get in the tent and understand these issues was critical through narrative. So we tend to pick stories that have some really strong characters, people who can help us tell that story. We also wanted to tell stories that might be a little different from what people might think, oh, I've heard about this Clean Air Act for 20 years, what's new, why should I care? So we did pick some stories in rural areas. We didn't go just to Chemical Alley or Texas, where we could have picked any number of plants in Texas, but we actually deliberately chose not to do that because we knew we could tell the wider story through other means. And so we actually homed in on one community in Tonawanda, New York, that had itself fought this emitter in a very novel way, and I think it illustrated the grander themes that we uncovered in the research. These people in Tonawanda had spent decades essentially telling the state and the EPA, there's major polluting going on, our air quality sucks, we need to do something. what happened was everybody kept saying, no, no, everything's fine. The reporting is fine. There's no big deal. Well, as it turned out, they went and tested their own air in a very rudimentary way, and they started what's called a bucket brigade. And they tested their own air, and it turned out that they were right. And later, when the state was then forced to go in and test the quality of the air, it did turn out that this particular plant had underreported its emissions by they ended up being 30 times higher than what they were supposed to be. So I think that was one of those stories that we knew might get people kind of to understand the wider themes. There's many more communities like that across the US. And again, as Robert illustrated, we're trying to reach out to all those reporters that we don't know might have been poking away at their own emitter for who knows how long. And it gives them a new reason to go after those stories. And as Jim said, we've already had folks in Arizona, Texas, Iowa, many other states following up and taking the national story and then making it work on a local level. So I think I'll end it there.
Video? Can you show the video?
Yes, and I will actually roll the video of our, we also do a lot of multimedia, so we chose to tell the story of Tonawanda both on the radio and in a video form, and they told quite separate stories, so we'll let you look at that and see what it feels like to be a resident of Tonawanda, New York.
Sound?
Sound.
No sound. Yeah, I think it's fine on webcast.
It's playing in the webcast, but not on. Oh, that's interesting.
Do you want me to see if the audio is
Sure.
working?
You can put the mic down by your.
We don't have plugins. I think it's muted. It's muted.
It's a great video.
Do we lose the feed?
This happens a lot when we do
I
radio.
know, it always
It's
happens.
bizarre. It's like,
It always happens. This is
this is
Oh, there we go. Just put the mic. Put the mic next to the.
Do you?
You want to put the microphone near?
Yeah.
Until I went out to the West Coast and visited San Diego, and I didn't realize
You're gonna get an echo back to the,
Oh.
it's not a microphone for the room.
Now, we should just.
Just put the microphone down.
Just put the microphone down.
It creates a playback.
Okay, there's no audio on the webcast.
Oh, there's no audio on the webcast either?
Only from the mics, yeah.
Okay, then we
Why
could
don't
put
we
it in.
point the mics at
Then point the
sound?
mic at the sound. Then just point the mic at the sound. Is the sound coming? What's catching up?
Yeah, it's.
Water's a nice place to live. And it is. I mean, they have, parking little stores and buses that go through or whatever.
Closer.
I didn't know about the plans. I did notice them because they're maybe a mile or two away.
I've lived in Tonawanda my whole life. I didn't notice the difference until I went out to the West Coast and was sitting in San Diego on the beach and realized, this is clean air. This is different.
But it didn't take too long before every time it would smell bad, and I'd look on the news to see which way the wind was coming from. I would drive around and hunt for the same smell. It was Tonawanda Coke.
This is where the air goes in this bag. It's called a Tedlar bag. You disconnect so bad that I finally went to the doctor, and he said, we don't see anything. I went through MRIs, MRAs. I ended up going to a lung specialist, and I told her, you know, about the burning sensation and how I've been sick, and I was told I have a tumor in my lower right lung. She goes, first of all, where do you live? I go, in Kenmore. She goes, what street? I go, Westgate. And she goes, you're by the Tonawanda coal plant. I'm telling you to move. If I go down the street I grew up on, there's maybe a handful of houses that have not had cancer. My son said to me, Mom, why did you stay? I said, what's the point in leaving now? I said, and if I just pick up and leave, who's going to stay and fight? The smells have not stopped, and people reporting that they've not stopped on the Facebook are there on a regular basis, so it's still a problem. And I really think that the health department should come in and start doing a little bit more, because there's people that are sick. With my mom being sick and passing away, and knowing she was in the yard all the time, that she was gardening, that she was always breathing in that air, because she was always outside in the summer, did I really want to know that doubt in my head now, what if we never moved here? Would my mom still be here? It's a constant thought.
Is this going to go on? Oh, it's not. Oh, okay. That's it.
Great. Okay, questions? And if you're on the phone or on the webcast, you can, again, questions@ombwatch.org, and we'll ask them for you. Questions, comments from the audience? Yes, please. There's a mic up here. We need to have you do that so they can hear you on the webcast.
Darius Sivan, United Auto Workers. I'm wondering if the plant was releasing that much benzene into the outside, what was the rate of leukemia and other cancers among the workforces? It must have been enormous.
I don't know. We need to talk about the fact that we were focusing on the emissions and analyzing whether the plant was. We weren't looking at the overall health risk in the community. Although obviously, when we start publishing the map, we were using the EPA's own data in terms of how they were analyzing the risk in various communities. So we did not investigate that community in that kind of, to that scope. So I can't answer that question.
Okay.
Right?
My question was specifically
Yeah.
about the workforce, not about
Right. So I just
community.
don't have
Okay.
the answer to that question. But in terms of the way the state ended up looking at the risk to the community, that is there, but it's not, we didn't investigate the specific plant workers.
Okay, thanks.
Hi, I'm Jerry Poggi. I'm wondering whether you've thought, just on that last point, whether to access additional data sets. So for example, Occupational Safety and Health Administration has enforcement compliance records. Are they likely to be of assistance in giving a broader picture about occupational health that might occur with facilities?
I think we're open to all sorts of follow-ups, and I think that's a great idea. I mean, we don't want to just drop this, you know, in the next few weeks. So I think that definitely is something we should do.
So then in additional data that would be very important for community activism would be reportings about the company itself. Who's the manager? How do you get in touch with him or her? Who's on the board? What's their filings what's their profitability? How much are they extracting out of the community and leaving this legacy of pollution? And then the second thing that I wondered whether you've thought about allowing for input from other people about what's now becoming more broadly known. So are there going to be ways that we could inventory for a specific site all the local stories on radio, TV, and print media that would add to the data set of how the story is playing out in the community? And then second, whether citizen input would be a likely part of a future growth of the database.
We're already getting citizen input through the, what is it, Keith?
Insight.
Personal Insight Network, which is a button someone can click when they read or listen to one of these stories. And we're asking them to tell us their stories. Do you live in a community like this, or do you live in this community? If so, would you tell us your story, give us your contact information? I've gotten a lot of those. I don't know how much you guys have gotten, but
So this is both CPI and NPR. If you go to your
has
websites for this story,
there's a little button you click, and,
and then
it says,
and then
"Tell
you
us
can
your
and then
story."
you can tell your own story. And
Right.
does the story from the citizens go into a data set that you all only see, or does it
Yes,
become
we-
part of a public data set
No,
that
it's
others
not.
can
It
access?
doesn't go public because we're
Okay.
asking them to share information with us. But these are all people who presumably are willing to talk to us or talk to NPR. So I've
Okay.
gotten a lot of those already.
Okay, but it's not something that would be more, so people, for example, you could imagine in a local community, if people were going to your website and putting things in, they might find their neighbors across town if it was a publicly accessible data set. So then they could link up with other people who had some of the same problems, but that's not currently
Not
available.
currently, but we had talked about something like that, hadn't we?
Well, I can talk a bit about the bucket test. I mean, the Tonawanda story was, again, in part we chose it because these folks had used some pretty rudimentary methods at, when they first started to build these buckets. We used some basic pictures to illustrate what the bucket was like. We put it on the website. We let people go to various resources that if they're interested in having their own bucket brigade, how that would work, so that we're trying to steer them towards the people with the expertise, because we're journalists. We're not the EPA, or we're not testing the air, but we're trying to help people find the path to their neighbors and figure out how they can do something. But to be honest, we're looking for follow-ups and stories, but there's no way we could possibly even do all the stories that we already have. There's no way. Like we had to pick 5 to do. And so our goal at NPR is to try as much as possible to let the local reporters cover those stories, so that in the communities where they matter the most, that they'll get covered. Not every story is gonna make the national news, just because there's not enough space. But we can see that Jim's story on Hayden, that Howard Burkus, my colleague from radio, reported yesterday, the local reporter in Tucson has already followed up. So in a lot of places, there is this ripple effect, and that's what we want.
Yeah, I think that's what the genesis of this question. I'm just going to stay on this for a minute if I can, because I think the point was, given that you can't cover all the stories, if the information is coming to you from people who want to tell their story, then is there a way that you could make it more publicly available so you don't have to mediate local reporters who want to follow up on the story themselves, or local citizens who want to find each other? I think that was the suggestion for maybe the next iteration of how you think about it.
I mean, I think as news organizations start using social media more, we're going to see more and more of that. And, it's just, I think there's a couple things going on there. The social media team, if the organization has one, has to start spending time on that. And then there needs to be an audience expectation that develops around that idea so that people actually use it. I think going forward, we'll see more of that.
Great. Yes.
Good morning. My name is John Walk. I'm the Clean Air Director for the Natural Resources Defense Council, and I just wanted to commend you on a really tremendous series and a service to the citizens of this country. I'm pleased to hear Jim and Suzanne both say that you're open to follow up, because I know from my practice that there really are systematic government policies, practices, and rules that lead to excessive exposure to air pollution. and result in these situations occurring all over the country. Just as an example, the Americans' greatest exposure to cancer risk from industrial pollution actually does come from benzene, but it's from fuels, gasoline, and cars more than anything. Yet we have a government policy from the EPA that's been in place for decades that allows states to place no monitors near highways. 35 million Americans live near highways, within 500 meters of highways in this country, and are exposed to benzene there. And surprise, surprise, there are no monitors measuring toxic air pollution, smog, or soot pollution within 500 meters of highways in this country, perhaps outside of California. And so we don't have, and believe me, that is a very conscious decision because they know what they find. It's a don't ask, don't tell pollution problem. And so there are these systematic inequities in the system that result in these ad hoc problems in thousands and thousands of locations. And again, you have just done a terrific service to the country and the public by beginning to highlight that. So thank you.
Good morning. At the risk of NRDC hogging the microphone, my name's Ed Chen. I do communications and media for NRDC. And maybe this is more appropriate to just have a discussion offline, but I'm wondering if you all would go back to the genesis of this project, because we at NRDC have been talking about and exploring ways of doing similar kinds of reporting to report and gather the information and go to a mainstream media. I'm just wondering, for example, Jim, could you and NPR folks talk about the process that brought you together and what challenges and obstacles that you all faced even starting out well before the finished product came out?
Sure. Again, as I mentioned earlier, I've been covering these sorts of issues for, unfortunately, more than 3 decades. And so I had a sort of general knowledge that this stuff was going on, although I had never dug in this deeply before. So we started looking, before we even heard of the watch list, we started looking, digging into the toxics release inventory, which most people are familiar with, and ECHO, which is, let's see, Enforcement and Compliance History Online, which is the EPA's enforcement database. We use these just as roadmaps. I mean, there are data problems. We heard a lot of complaints early on about poor data quality in ECHO, for example. You can't assume that they've recorded all the fines that a particular facility has gotten. So we knew that going in. So we simply used it as a roadmap. And then we did what I would call just basic shoe leather reporting. We picked up the telephone. And once we found a facility that looked interesting, looked like it had a lot of violations, it was considered there is a flag in there for high priority violators. It's a yes or no, HPV, yes or no. So if it said yes, there's a way you could see how many quarters it had been in non-compliance with the Clean Air Act, the maximum being 12. 12 of the last 12 quarters, this place has been out of compliance. So we use that as a starting point. And then, like I say, we picked up the phone, we got on the internet, we looked for legal filings, we started talking to people, and we started to boil it down. And NPR joined us at that point. And again, this is all before we got the watch list. And then we just sort of went by our gut. We found communities that represented particular problems. We looked for a diversity of communities. We didn't want just poor minority communities because we knew that these problems were in middle class, mostly white communities. In fact, we're going to be profiling one of those communities soon in Iowa. So that's how it started. And then these guys joined us, and I think I'll let you pick it up from here.
Well, as Jim said, we looked for themes that we could support through the other research. One theme was the one I mentioned in Tonawanda, where you had communities. A lot of people told us across the country, until communities start to do things, nothing happens. And in some cases, they fight for many decades to get something to happen. And so we profiled a few of these places. We went to Tonawanda. It's an industrial area, so it kind of represented that idea of as you mentioned, the benzene and some of the worst of the worst. But we also went to Ponca City, Oklahoma, where we had communities where Native Americans had come together with white farmers, and over decades they had complained. Some of these people had complained for 50 years. There was one farmer who started complaining decades ago, and essentially the pollution there was carbon black. But we also went to Chanute, Kansas, and that was probably for us, and Howard and I spent many hours on the phone talking about how much this story made our heads hurt, because this was a story about the burning of hazardous waste in cement kilns, which is sort of a subset type deals that was struck 15 years ago, where these cement kilns burn this toxic sludge that is so toxic it cannot go in a landfill. However, they have this special little dispensation to burn it in the cement kiln. Not a hazardous waste plant, which would have certain rules, but this other little narrow, and trying to explain that in 7.5 minutes on Morning Edition was really tough. Because there you have a situation where the rule is actually set so that nobody really breaks it. And yet, the community's still saying, is the rule actually the right rule to have, right? So it's a tough one for radio, but we did tackle that one. So, you know, we tried to pick something that was counterintuitive that way.
I don't think I made myself clear. I'm more curious about the collaboration between a nonprofit and a mainstream media outlet, because we all know that investigative reporting is a dying art in the mainstream media because of
we're a nonprofit too.
No, I understand.
We're a nonprofit,
You're
and
also mainstream.
okay,
But I'm just wondering, what is the challenge? When did you all get together to do this? Because I think this is a model for a lot of the future.
Okay, I want to be clear about who the Center for Public Integrity is, and either Jim, you can take it, or Bill, the president of the Center for Public Integrity, might want to take that question. And then we have a question online, and I think we have to wind this part up and then let our two respondents come up.
And so I'm here to read a question from one of
Wait.
our...
Let Bill respond to that question first. Sorry, Jessica.
Just really quickly, I think the power of this, I'm sorry, I'm Bill Busenberg. I'm the executive director at the center, and I'm really proud of this work, obviously, which has gone on a long time and it's very expensive.
And any funders in the room, he needs some more support for this.
Look, we are distributing our work now. It is going everywhere. This was the big top of Huffington Post the entire day with a big picture, and they used it. They're continuing to use it. We are getting our work in, you name the networks, name the newspapers, they're using it. The real power of this has been at the local level. And what we are seeing spreading out now, every day there's story after story after story. We have given, this started as, these are two national news organizations, but they're providing local information. So local news organizations. We went to the Investigative News Network, which is 60 little centers, gave them this information. A bunch of them have done their local investigations. The local newspapers, the local public radio stations, they're all saying, oh my gosh, that plant we've been complaining about, here's the data. Oh, it was on a watch list. Oh, it's been in violation for 12 quarters. Oh my gosh, there's 20 pages of complaints. It suddenly is a story locally. Now, I love it when we get information through the Public Insight Network, but the real power of this is to do local investigations and empower people not only to measure what's going on, but then to take action about it. And so often, we did the national story. We see the pattern. The pattern is these plants, oh, they emit a lot of stuff at night when they're not being tested. And, oh yeah, they report their own emissions, and they tend to forget how much they really emitted. And, all of that is the pattern that we've shown. Every local community, 17,000 places, they can do work around this. We can continue it. We can keep doing it. I'm sure groups in this room can use this information, but that's really the power of this, is that local community.
Great.
Okay.
Thanks. And Jessica, do you want to do a phone question, and then we'll shift out and I'll introduce you all as you come up? Go ahead.
Absolutely. This is just a clarification question from one of the participants watching the webinar. He notes that his question is whether all of the facilities on the watch list are on the high priority violators list. He says that the report notes that some of the facilities on the list are not necessarily toxic polluters, but they were there for reporting or regulatory reasons. And so he just asks whether there's a way to screen those out.
We did an analysis of the September list, which was the most recent one we had, and we found that 95% of the facilities on the list were high priority violators. So yes, there are probably a few on there that have, what you might call paperwork violations. But again, the vast majority were considered high priority violators.
And just to go back to a point someone made earlier, and Bob, you sent around to us, Elizabeth Grossman has recently saw your work and did an article that said that actually people who have OSHA violations, the multiple OSHA violations, are also many of the high violators on the EPA list. So there's a connection between people who violate in one area of the law and regulations in the other. So it kind of confirms that these are kind of the bad apples that aren't following the rules, right? Can I ask you to? Where did Andy go to? Okay. One more question.
Hi, thank you for the presentation. There have been a few cases now where there are open data platforms being set up so that multiple data sets can be provided and built upon, including by citizen actions. And I just wondered what would be the opportunity or the constraints on you all for moving some of this into kind of an open data set where, for instance, citizen groups or local reporters or kind of local, or state government agencies could add their data to it. Are there institutional constraints or other concerns that would make that difficult?
There are, and they're above my pay grade.
Very nice. Well, I think there are limitations, and we frequently get asked that question about, providing our data or our raw data to other parties. We generally don't do that for a bunch of reasons. One is it took, Liz Lucas, Robert Benincasa, David Donald, and many others a year and more to crunch this stuff. We had multiple meetings, and we actually threw out our first interactive plan because it just wasn't interactive enough. We didn't think it would translate to the audience or the user. So we know that it's hard stuff to work with, which is why we tried to make it accessible in a way that you can go find the information. If you're really, really into it and you go to that EPA page on your emitter, you can find out anything you need to know to get you going. We are also committed, once we have an interactive like that, to updating it and keeping it current. And we will be doing that when we get new data. But to be honest, that's about as far as we can go because we do have resources constraints as well. I mean, in our team, we're 8 people. There's a limit to what you can do. But I think it's a good start. And this one, of all the databases that we've worked on, Robert and I have done a couple since we've worked together, this is probably, I'd say, the most accessible and the most democratic that we've done. So, I mean, you can get better at it. You can try and make sure it spreads out. But I think, you also have to stay within sort of the workability of these 3 data sets working hand in hand, and that took a long time to figure out. Does that answer the question?
Sure.
I think there is a model. I'll just throw it out. Sometimes when researchers have put a lot of time and effort into doing the work themselves, and they collect their own unique data sets, then and other people have funded the data. After a year, where it's completely owned and proprietary by the people who actually did the work to do the data, then they open it up and make it public. So there's some time frame where, you all have first. So that might be something that you think about eventually at some point.
I mean, I'm just to go back, and I think Robert can explain this way better, but if you look at the risk factor numbers, honestly, if you just look at that data, you have no clue what it means. There's just no way. So I just think it takes context, and it takes a lot of expertise to be able to figure out a way to visualize that. And that's what they did, and it took them a long time. So I don't know how useful it would be if you gave people raw data. It's already accessible anyway. You can get the TRI.
You can get the raw data.
But I don't know. What
Well, I
do you
mean, I
think?
think depending on the situation when this has come up before, and I've been asked for raw data after we've done an analysis and a project, and I've generally, in some cases, the way I look at it is it's akin to asking for a reporter's notes. These are, you know, a lot of things happen in the preparation and the analysis of the data that are essentially things like a raw interview. It's akin to or analogous to your notes from an interview, and that's why I generally would err on the side of not releasing that to the public. Others in journalism feel differently about it, but that's sort of my take on it.
Okay. We have a really short question, and then we're going to have the other two respondents come in and do their panel. Go ahead, Jess.
Yep. This is one other clarifying question about how the data can be used. One of the online participants wants to know if it can be sorted almost at a corporation level, so that you could look for bad corporate actors who have multiple violation sites in different areas around the country.
It's possible if you had the raw data, yes, it is possible.
No, but from your site?
No.
There's no, like, sort by firm or
No,
sort by corporate
that
parent
functionality is not built into the interactive.
Okay, that's fine. All right, we're going to have a couple of respondents. Andy and Lois, can you come? If you want to stay, you can, Rebecca, since you're a little less mobile.
Yeah.
So we're running a little late. I'm going to do the introductions as they come up.
I think I might.
Okay. Rebecca said, until communities get involved, nothing happens. And what we have here is two people who help communities make things happen. Andy Egregious is with Safer Chemicals, Healthy Families. He headed the environmental health program at the National Environmental Trust before coming to this campaign. Led a lot of work on chemical safety, right to know, food safety, California initiatives like the Safe Cosmetics Act. He worked for California PIRG, the California League of Conservation Voters, Californians for Pesticide Reform, and spearheaded passage of the Clean Water Enforcement and Pollution Prevention Act in California in 1999. Wow. I can talk fast. Lois Gibbs is the founder and executive director of the Center for Health, Environment, and Justice, an organization that's provided technical assistance and advocacy support to over 12,000 grassroots environmental justice groups around the country. She's been featured on many media programs from 60 Minutes to Oprah Winfrey, has honorary doctorates from 3 different universities, and has been the recipient of a number of leadership awards for her groundbreaking work in this area. So I think, Andy, you want to start? Is that correct?
Oh, no.
Or Lois? Did you guys decide?
We didn't actually decide. Why don't you go?
No,
All
go
right,
ahead.
okay.
We have you down first,
You have me
Andy.
down first? Okay.
Okay.
Thank you. You can't beat Oprah Winfrey. I think that's the best honor of all of them.
NPR is pretty good.
NPR is pretty good. Well, thank you for having us. I'm with the Safer Chemicals, Healthy Families. It's a large campaign. It's worth just saying a few things about it. It's around 300 organizations. It includes the national environmental groups like NRDC and EDF. It includes Lois's group. It includes state-based coalitions that have been passing chemical policy at the local level, a lot of community-based environmental justice groups, health organizations, the American Nurses Association, the medical school at Yale, Mount Sinai, an interesting cross-section of community, state, federal, and health professionals and health advocacy groups are all in this together to reform chemical policy. And what's interesting about the report is how much it gets at a lot of the themes that I think our coalition has been grappling with. We've been grappling with them in one particular area, but I think it raises all of them. So just a few things to raise. One is just it's exciting to be up here in response to an NPR report, because I do think NPR is in some ways like the last of the Mohicans of mainstream journalism that really gets at important issues, and the decline in that is something that has affected the basic work of advocacy in ways that I think we haven't all really fully grappled with. And the kind of partnership that has been created here, and the idea of using the web as an ongoing tool that communities can use directly is just something we need more of, because the ability to have a nationally galvanizing conversation, a national galvanizing conversation about important issues, I actually think has diminished, and it's affected this kind of work. In a lot of ways, the model for doing this kind of work that Ralph Nader and Lois and other people have pioneered has really changed as a result of that. So I think this kind of work we need more of, and I just applaud the Bauman Foundation and others for supporting it. On the issues, I think so many things were raised about it. The way that risk assessment and enforcement is actually practiced, how communities are factored into environmental policy, and then just this general problem of, I also think has not been grappled with, of really the decline of regulatory enforcement stuff in general across the board, and not just when Republicans are in charge, and not just a sort of, it's not just about, oh, the Tea Party and they beat up on EPA. It's really kind of an ongoing thing, and something that really hasn't been grappled with is the sort of, we're here at OMB Watch headquarters, the degree to which the OMB is really the czar of regulations and enforcement, the functioning of the federal government, and it's becomes a constant source of repressing the basic functioning of some very basic environmental health laws that, to a degree that I think the public hasn't fully grappled with. And it's happened most recently on some incredibly moderate, incremental rules related to chemicals, and that's even happened under the Obama administration, and that was happening even before the Republicans took control of the House. So it's not just, a lot of what's happened isn't just about any triangulation that's happened. On the issues, one of the things that we grappled with very carefully in this campaign and wanted to put up front was the interaction of what's happening with actual people and actual communities and a broader policy issue like chemical policy reform. And our campaign is not set up around Clean Air Act enforcement, and we have an expert in the room, and John with NRDC, who people should turn to for questions about that. He's really the top expert. NRDC has been doing great work to just try and have the basic enforcement of the Clean Air Act continue. But we wound up grappling with this because one of the issues that Lois first put on the table, that, hey, you know what, even our national environmental laws, the degree to which they're the degree to which they've been out there and they've been implemented, they still ignore what's happening in the real world experience of people in communities. And our campaign decided to grapple with that and put it into the platform that we had for reforming chemical policy up front. So one of the platforms that's in there is actually that the EPA should develop a list of hotspots. That's what they're called in the legislation. The legislation is called the Safe Chemicals Act. And these are places that where there's disproportionate exposure to chemicals that might be both from air toxins and other areas, and the chemicals that are then the primary focus of a law like the Toxic Substances Control Act, which is the chemicals that are actually in commerce being used in products and coming into your home. But this acknowledgement that for certain communities, there's this backdrop of disproportionate exposure from pollution before you even start looking at the chemicals that are in your home. So they're having something extra that the average person isn't having, that needs to be grappled with. So it asks EPA to do that and to develop plans sort of on a separate track to reduce that exposure over time, to have action plans, to use all the authorities that EPA has to reduce that over time. And that's in the legislation right now that had its first legislative hearing in the Senate yesterday. It was actually quite contentious between the American Chemistry Council and some of the members of the committee. So I just want to say I think the report gets at that theme. Another is something I just think is very worth bringing up, which is this same critique that Lois most famously, but hundreds of other community groups and leaders around the country have put on the table about risk assessment and how the federal government practices it, which is that these decisions are cooked and they take too long, they come out late, and they come out wrong, right? That has been validated by the highest scientific body in the country, the National Academy of Sciences, to a degree that I think a lot of us hasn't been as celebrated as it should be. They issued a report. They were asked by EPA to do an evaluation of how EPA assesses the risks of chemicals. And they came up with a report. It's a book-length report called Science and Decisions in the end of 2008 that that has this critique, and they basically came back saying, for a whole set of reasons, some are legal, some are scientific, these decisions come out late and they come out wrong. They really said that, and they come out wrong in the sense that they're not protective enough. And they cited some of the things that Lois and other folks have worked on, like dioxin and formaldehyde. So I just wanted to put that out there, that I feel that this community level critique, it turns out, is not just valid legally when you do the work that has just been done to look at, gee, the limits that are on the books are being ignored. Gee, some of the reporting that's being done to say if we're in line with these limits is actually inaccurate deliberately, and citizens are now checking it. But it turns out that even some of the methodology that's being used to measure the information that comes in, you have the National Academy of Sciences is saying is flawed and is not protective enough. And they made concrete recommendations to fix that for EPA. And those recommendations, by the way, are among the things that are being pushed in the Safe Chemicals Act and are part of the platform for this campaign that combines all these groups. So I just wanted to, that's part of the reaction I think have to that, is that there's some vehicles to address this, and it really does reflect an increased understanding across the nonprofit health and environment community to be incorporating the kinds of issues raised by this report.
Great, thank you. Lois.
So I'm going to respond from a grassroots perspective. The folks in Tonawanda are the folks that we've worked with for the last 5 years, before anybody noticed it. In the raid they actually had a raid. It was an honest-to-goodness raid where policemen came on Christmas Eve 2 years ago and took the manager out in handcuffs and his files along with them. But it took 20 years to get there. So you know, standards of protection by our government, health, and environment, it doesn't exist in the real world. It exists in the rules that you see, but in the real world it doesn't. And this report has been so powerful to grassroots people across the country. So in Ohio, for example, which was one of the largest polluters according to the data and had the most violators, they've been fighting for years, as same as Tonawanda or the smelter in Arizona. And because of this report, people are actually paying attention. People were told that it wasn't a problem. The local paper will cover a problem, but because they can take this NPR piece and put it out there to their local neighbors, people are like, holy moly, they've been validated. It's now a problem when it wasn't a problem. And now they're having a meeting to talk about what are we going to do about this and what are we going to do. I mean, anybody who's worked in the environmental health movement over the last 30 years knows about WTI, which is an incinerator that's been fought forever. This is an incinerator that is part of your study that shows that it's been violating. This incinerator has not been in compliance except for 2 quarters in its entire life, and it started in 1995. When we took it to appeals court, according to the law, if they're out of violation but they have a plan to get back into compliance, then they are considered in compliance even though they're out of compliance. And so these are so when you talk about rules and laws that protect the people, this report helped us expose how stupid this is. And it's stupid because people live there. They had to close the local elementary school next door because the children could not breathe in the school. They had the city of East Liverpool had to pay to build a new school because of a polluting industry. That's not to say that this industry can't operate without pollution. Of course it can, but it won't, because why should it? All it needs is a plan to become compliant to be compliant. It's just that simple. It's insane. So all across the country, I just think that our phones have been ringing. Our email has been buzzing. And I'm just going to stick with Ohio because it's just simpler. We work in every state practically. But what's interesting is that there was a study that was going to be done by a university in Cincinnati in a northern part of community in Ohio. Because of this report, they said, let's expand the study. Let's not just look at this neighborhood. Let's see what else is happening in this larger area to both children and adults. In other places, people are saying, you know, the El Paso smelter is exactly like the one in Arizona. And if Arizona is getting this kind of help, we want this kind of help. So how do we here in El Paso deal with our smelter that we've been complaining about for years? And it's actually a huge workplace issue. The workers have been involved since the get-go in the El Paso site. So it has generated all this buzz. But I think what's really important about it is that it's investigative reporting that we don't see so much anymore, quite honestly. I mean, at Love Canal, 60 Minutes is what turned the tide for us in their investigative reporting. So this investigative reporting, bringing it back, doing it not just on a single site, but looking at a much bigger arena, looking to answer a much bigger question about the standards of protection from environment, pollution, and health and safety risk is huge. It really, really is huge. So I think that's critically important. I think that putting the faces, the stories, and not the same stories. I mean, I love the people in Cancer Alley more than anybody else I know. But to tell that Cancer Alley story again is like heard it, been there, saw it, heard it, you know, to really look at Ponca, Oklahoma. Oh my God, we were working with them 20 years ago. It was just amazing. That, you know, to look at these ones in different places that people haven't heard about. And it's not just about poor people. It's about farm people. It's about working people. It's about poor people. It's about black people. It's about, I just thought that was, the stories were just fabulous. It carried the day. It really moved it forward. We used to have a campaign. You have Poison Places. We used to have Forgotten Faces. And so what it's done is it's taken our forgotten faces and reminded people that they are still there. I'm hoping that it will in turn, and I think it's way too early to tell, but I'm hoping that in turn it will actually move some of these policies. And I think that it's going to be a huge help. I don't have to be unbiased. I am very biased. Our government rules are horrible. The attack on Clean Air Bill and Clean Water and the rest of them is outrageous. And I think your report will be used highly by those of us who want to move forward this, as well as the issue around TSCA and chemical policy reform. I mean, I just think it's really huge, and I really appreciate it. I love the map. People can look at the map, they can see what's there. People in our network do understand the ECHO database, so it's not quite so foreign to them. It's kind of like a piece of their everyday work, so that they get that piece. And I think that lastly, what I wanted to say, which I think is really important, is it does something different than what we generally talk about. We generally talk about the risk from Tonawanda coke, and benzene was the culprit there that was the highest. But what your report does is it shows people it's a synergistic effect, that it's not just East Liverpool WTI facility. It's not just Tonawanda coke. There's actually 43 industries that are in that community, and that there is some work to reduce the emissions. And it's a collaborative work with the group and the city and the state Department of Environmental Conservation, the Environmental Agency, and the U.S. Environmental Protection Agency to try and figure out how do we deal with Tonawanda so we protect jobs, we protect workers, we reduce emissions, and we keep the community safe. And so this has really helped to move that forward, and we could look at Tonawanda as a model for other places. So thank you guys so much for doing this. I just think it's extraordinary.
That's great. We are running way over time for the webcast, so I think we could not have asked, you could not have asked for a better endorsement of the importance of independent investigative journalism and reporting at the national level on key issues for the American public. So I think this is just from all of us. Thank you for this wonderful work that you and NPR have done. We're going to close out the webcast at this point. So thank you all for staying with us. If you want to, can they still call in on phone once we, okay. Sorry, but we're gonna close out this part of the webcast, and then we're gonna continue to have a conversation with the advocates who are here once we've cleared the room of our reporters. How's that? Thank you again.